So good afternoon, everyone. Today we are going to discuss about my topic narco-analysis or drug-assisted interview. Hi, I'm Dr. Akash Chaudhary, Junior Resident, Subharti Medical College. A brief overview what we are going to discuss today. It will be comprising of introduction, historical background, drugs used, uses, legal and ethical consideration, and abreaction. So first, deception detection test DDT. It basically comprises of three types of tests consisting of polygraph tests, brain mapping, narco-analysis. There are other tests as well, which we are going to discuss further. The term narco-analysis was coined by Horsley J.S. in 1943. It's a Greek word meaning anesthesia or torpor. So what is narco-analysis basically? Administering psychoactive drugs to lower inhibitions, facilitates retrieval of repressed or concealed information. Commonly used drugs are sodium pentothal and sodium amytal. So first early experiments were done by Dr. Robert House and William Blackman, and evolution of these techniques were further carried forward as the research progressed. In the 20th century, researchers observed the psychological effects of a few drugs. Use in forensic medicine became known very much later. Robert Ernst House was a physician and was an obstetrician. He discounted this term truth serum while experimenting with scopolamine to obstetric cases. He discovered that the drug induced a mental state in which the patient could not hide his reactions and so would reveal it was thought what he considered true. The discovery established a nationwide reputation. He also used the drug to diagnose, treat insanity by detecting patients' delusions and to induce twilight sleep in obstetrics. So basically, while he wanted to make easier for the mother to deliver the baby, at that time he started administering scopolamine so that it becomes less painful. What he observed while doing this was that the patient was telling their repressed emotions or thoughts, whatever they were going through, which they never revealed. When he cross-inquired with the patient's husband, it came out to be true. And from that day, it became known, something such as truth serum, which consisted of scopolamine. They were widely used in the United States in the post-World War II era, when only a few psychiatric treatments were available. In 1930, Dr. William Blackman introduced narco-analysis as a therapy for severely schizophrenic patients or those who suffered from catatonic mutism. These people, after being administered the drug, would be released from their somatic state for short periods of time. They could carry on conversations, partake in meals, and behave as if completely healthy. However, the effect was temporary. Purpose and goals. So basically in this image, what we are currently, the slide is not related to the image, but the image basically comprises of the polygraph test. What we usually encounter, what we usually see over the televisions. So basically here in the fingers, there's the monitoring of the heart rate through the electrodes. Then there's this BP cuff which was present on the other side of the patient. And the belts that the patient is wearing are called pneumotubes. So when the patient comes in, basically we ask the patient about the normal things like आलू का क्या भाव चल रहा है या फिर कोई भी daily observations. At that time we get to know the standard or what the baseline of the patient through heart rate, pulse, BP, and the way the patient respires. Following which in patients are asked without any known knowledge about the questions that the patient will be going through. These tests have been carried out for many years, and there were two shows also available in Indian cinema. One, there was this movie called Right or Wrong, in which they have shown this polygraph test and how it can be faked or how you can get out of it. And the second was Sach Ka Samna, which there were two brief episodes for 2 years, and then the show got discontinued. The technique that they used throughout that interview was uh, polygraph test. So the ways you can fake polygraph test are that if you are antisocial personality disorder, you are a habitual liar, you don't think twice before lying. So that time the validity reduces greatly. And some people in UK and World War III era, like people who were in the American people, the scientists said that it's only applicable for the people living in America, not for the people elsewhere. According to him, they were more emotionally in touch with their feelings as compared to the people from the post-Soviet era or people from Russia. So the way they can fake it is by applying pain stimulus to them. So this has also been shown in this movie called Ocean's 12, in which the thief goes through a polygraph test and he installs a pin inside his feet. And whenever they ask a question, he starts pressing it. So whenever there's this painful stimuli, you can start faking these tests. Purpose and goals for information retrieval in criminal investigation, therapeutic applications, exploring suppressed memories in psychiatric practices. Drug used is sodium pentothal, also known as truth serum. Its dosage and administration. Sodium pentothal is a rapid onset short acting barbiturate. The usual dose ranges anesthesia from 3 to 6 mg per kg. Patient's factor include age, sex, and lead body mass. Specific disease condition that can be dose requirement of thiopentone, and for that matter, any other IV anesthetic, and hypovolemia, burns, azotemia, liver failure. A wrong dose can result a person going into coma or even death. The mechanism of action: effects of sedative drugs on the central nervous system, induces a trance-like state, reduces conscious resistance. So sodium pentothal mechanism of action. This will be of great interest to you, as this is a question which usually comes in NEET examination. Basically, there's this question: what's the mechanism of action of a thiopentone and a benzodiazepine? So the correct answer is that it prolongs the opening of the chloride channels as compared to the benzodiazepines, which increases the intensity of opening of the ionic channels. So that's how sodium pentothal works. It's a barbiturate. It prolongs the opening of the chloride channels, which causes brief sedation to the patient. It is also, barbiturates are also used in smaller operative procedures, as in for local surgeries or any others, because the patient stays conscious but he does not feel the pains whenever going through the procedure. So methodology: it consists of pre-interview evaluation, administration of the drug, questioning phase, and post-procedural debriefing. So first, pre-interview evaluation, it's almost similar as the PAC that the patient goes through before going through a surgery or a pre-anesthetic checkup. Medical history reviews to assess suitability of the procedure, psychological assessment to understand the subject's mental state, detailed discussion of the purpose of the interview or potential implications for the subject. An informed consent is given to the patient before the patient goes through the narco-analysis or polygraph test. Currently, we are discussing about narco-analysis. Thorough explanation of the procedure, including potential risks and benefits, obtaining written consent from the subject to undergo the interview. Drug administration: a small dose of sodium pentothal is administered IV by a qualified medical professional. Then there comes this questioning phase. The interview asks specific questions related to the subject matter of interest, using open-ended prompts to encourage detailed responses. The interview may need to adjust questions based on the subject's level of responsiveness and potential emotional reactions. Observations and recording: the interview closely observes the subject's verbal and non-verbal cues, including body language and emotional expressions. The interview is typically video and audio recorded for later analysis. Then there's this post-interview debriefing. The subject is given time to recover from the drug's effect, discussion with the subject regarding their experience, and any significant information revealed during the interview. It comprises of team of clinical forensic psychologist, a psychiatrist, physician or anesthetist, audio videographer, a writer, and supporting nursing staff. Role of a psychiatrist: basically to ensure the patient's safety regarding whatever the patient is going through the procedure, monitoring physiological and psychological responses, the responses if they are adequate or not, or while giving the patient's state and how it revealed. It's basically, he's also there to count the minutes of the meeting the way we do, what's happening minute by minute. He's there to basically check over the procedure and the steps that the patient or the interpreter is going. Then there's interpretation of responding during the questioning. This is all overlooked under the psychiatrist's watch. Now, these are basically the drawbacks of role of training: importance of trained professionals, ethical training and certifications, and psychological evaluations of skills. Applications in psychiatry: it can be used in trauma therapy, dissociative disorders, exploring the subconscious conflicts. Application in forensics: criminal investigations, verification of witness statements, high profile case involving narco-analysis. Ethical considerations: so basically the legal framework in India, narco-analysis was first used in 2002 in Godhra carnage case. It was also in the news after the famous Arun Bhatt kidnap case in Gujarat, wherein the accused had appeared in Supreme Court of India against undergoing the narco-analysis. It was again in the news in the Telgi stamp paper scam, which was carried out in Maharashtra, where Abdul Karim Telgi was taken to the test in December 2003, and very two big high-profile cases were revealed in the narco-analysis as the video got leaked, which we can discuss after the presentation. Narco-analysis was in the limelight in the context of infamous Nithari village Noida serial killings. The two main accused of the Nithari serial killings, Maninder Singh Pandair and Surinder Kohli, underwent a drug test in Gandhinagar, Gujarat. So these are basically the cases that we just discussed. Now, the landmark judgment that came was Selvi and other states of Karnataka, in which basically the first time the ethical consideration of this test was discussed, in which the prosecuted like Selvi went to the court that what is the validity of this test and how his human rights are being harmed while undergoing through this test. After the hearing, there was a special guideline given in the case. In 2010, the Supreme Court of India ruled that the use of certain scientific techniques in criminal investigation violates the right against self-incrimination and the right to life and personal liberty. What was the case about? The case considered the constitutionality of using certain scientific techniques in criminal investigations, such as narco-analysis, brain mapping, and polygraphs. The court ruled that if an accused volunteer for the narco-analysis test, they must have access to a lawyer and fully informed to the physical, emotional, and legal implications of the test. The Supreme Court emphasized that the guidelines for the administration of polygraph tests published through National Human Rights Commission 2000 must be strictly followed. The guidelines state the narco test cannot be conducted without the subject's consent, which must be obtained before a magistrate. A forcible intrusion into person's mental process is considered an affront to human dignity and liberty, and the court recognized the right against self-incrimination. The ruling established that the result of narco-analysis tests are not considered confessional, but lead to discovery of valid evidences. Subsequently, in 2013, the Supreme Court turned down a petition to produce narco test reports in Arushi Talwar case, deeming it an attempt to delay its trial proceedings. Despite these guidelines, challenges persist in ensuring uniformity in application. So basically, in a nutshell, we can't, through this verdict, if somebody is undergoing a narco analysis and he says that I have committed a crime, the value of that statement is 0, even if he accepts it. So this is one thing that which should also be available to general population public according to Article 19, if I am not correct. If there is forced, like if a police takes you or grabs you somewhere and asks you to say that you murdered a certain guy or certain woman and asks you to write it down over the paper, you can comfortably write it down because it does not stand in the rule in the court of law. If somebody says that you have committed a crime, write it over the piece of paper, it won't stand. You can, at that time, you can just go away from that. You write it so that somebody doesn't harm you. And then in the court of law, it doesn't stand any standing. So what is the purpose then of narco-analysis left? If you are basically sedating a patient and he's accepting all his crimes, but still it is not of no valid use. So what, for example, what I can say is, like I have murdered somebody and I have ripped his head off. And then I have hid his head somewhere and the weapon that I used, I have hid it somewhere else. So if while I'm sedated, I say that I have committed the murder, it doesn't stand anywhere. But if I am able to tell where I have hid the weapon or where I have placed the head, and you are able to basically take out the information so that you can form a bigger case around a person, at that time it is used as a supportive evidence. Still, its validity is way less as compared to if the patient is fully conscious and he is giving consentfully his incrimination. Then only it's valid. Western countries, the United States, World War Fifth Amendment, and in Europe, basically this doesn't stand over there as well. So the Western countries in which the first when they got to know about this thing, okay, there's this thing called polygraph test or narco test, they were very interested after World War. And many of the accused or the war hostages went through these tests. They were also able to retrieve this important information regarding the hideouts and the bunkers of the opposite parties. But as time passed on, the argument that the law enforcement used to give to the court and judiciary was that it used to lessen the time of investigation and less resources were used and the acquittal was in way high as compared to forming a case and finding evidence towards the primary accused. but it came under the Fifth Amendment, which is in United States, the basically which harms the. One second. Give me 1 second. Yes. Narco-analysis involving the use of drugs scopolamine on criminals in the United States was first reported in 1922. European countries generally adhere to the principles of human rights and privacy, which may lead to greater skepticism regarding the use of truth serum or similar methods. The European Court of Human Rights has set a high bar for the admissibility of evidence obtained through technique that may infringe upon individuals' right to a fair trial. As an alternative of narco-analysis, Western countries often rely on polygraph examinations. So both polygraph and both narco-analysis are quite questionable over the validity of the results. In polygraph test as well, there's this technique in which there's this thing called P300 waveforms in going through, which is more common in brain mapping. So the other third technique is called brain mapping, in which you place electrodes over patient's head. It comprises of combination of EEG and ECG. So basically somebody, we are asking you every day the similar questions, and in between you give them these hints, like if we are talking about, basically we are all psychiatrists, and somebody is asking you about, okay, are you a doctor, or what do you do in the hospital? So they are basically the patterns that they observe. This pattern is called P300. So whenever the patient is saying the truth, it suddenly there's this blink of a light and it shows P300 wave pattern. The problem with this was there were a lot of confoundings. Like if somebody has committed a murder and there are 5 people who witnessed it, all 5 of them have seen the case, and all 5 of them, when they'll go through a brain imaging, because everybody has seen the case and everybody will, the image will pop off. Okay, they know the accused, they know how the crime was attempted on, who got inflicted through the murder or whatever case is going on through. So everybody is a witness, but it's not a sure shot method to say, okay, this person was involved or not. Like if I'm currently presenting the seminar, everybody can see, okay, I'm presenting the seminar, my name is Akash Chaudhary. So whenever my name will flash on, the light will go on. But it doesn't prove that I am the one who's presenting the seminar, because you are able to relate the events that are currently going on. Controversies, again, reliability of the information obtained, violation of the individual human rights, and admissibility in the courts. Limitations, drug dependence and tolerance, possibility of false memories, subjectivity of the interpretation. I interpret something else, somebody else might interpret something else. As when the patient is sedated, he only sometimes replies in monosyllables, which you can't really make of a lot of information about. One of the most famous cases, Kasab also went through narco-analysis. And so they give you the possibility of somebody answering to open-ended questions is way less. Then you have to ask them those closed-ended questions. Then they start replying in 1 phases or 2 phases. Like the video which got leaked out showed ki, okay, you are Kasab, you are Ajmal Kasab, you stay in Pakistan. Then the reply from that side was yes. Then through their ID, they were able to ask him ki, okay, from which village did you belong? There's this video, very nice video over the YouTube, you can go over and watch it. He's going through a narco analysis and they're asking him about his whereabouts. Ki, where is he from? Again, the subjectivity is, ki, is he telling the truth or not? Or are you trying to instill those answers while he's sedated? So again, the subjectivity of the interpretation and its ethics value is questionable. Risk and complication, adverse drug reaction can occur while somebody is going through a narco test. There's a lot of emotional distress in which the patient who wants to conceal his personal life might be telling the patient or the person asking the question which he does not want to relate about. And long-term psychological effects. The repressed memories may come out of the subconscious to the conscious mind, which may haunt the patient afterwards. So these are the myths. Truth serum always reveals the truth. No, it's not absolutely true. Misconception about mind control, that you are able to control the mind while the patient is sedated, and public perception versus reality, like what we see in daily cases and over the news. Okay, the specific neta should undergo a narco test. Okay, is he telling the truth or not? The subjectivity, or if the validity of the result that might come out is not 100% valid. Like this question that everybody used to, other political parties used to say, okay, he's staying in he's a top graded terrorist, why is he eating biryani every day? Why they have spent so much of money keeping him for such a long time? Even if the patient is going through a narco-analysis, first they have to go through a daily interviewing technique so that they get to know the baseline, their mental state is what they previously were thinking. And then this subsequent questioning that goes on. So you don't have to go on to this petty facts and petty arguments regarding certain techniques. So ethics, how they gets violated. Respect for autonomy, patients' right to refuse and choose their treatment is still there. Nobody can force you to go through a narco test, no matter what. Beneficence, practitioner should be the best interest of the patient. Non-maleficence, not to be the cause of the harm and to promote good than harm. And justice, distribution of scarce health resources and priority of the treatment. Ethical safeguards, guidelines for ethical practice, monitoring by oversight committees, importance of transparency is necessary. Advances in narcoanalysis, integration with the neuroimaging. Another fact that these things are not yet proven to the people who are suffering from any seizure disorder. If there is any organic brain injury, how will somebody react and how will their emotional responses be when undergoing through these tests? This improved pharmacological agents, as previously scopolamine was used, now better drugs are available, and ethical safeguards. The future direction research on the reliability and accuracy needs to be worked upon. Development of non-invasive techniques. So the best deal that currently we have, which has the highest validity and which is least invasive, is brain mapping. And then ethical advancement, what is the correct method and what should be the future discourse of how to take forward these treatments. Integration with modern psychiatry, role in personalized therapy. If somebody wants to get out the repressed emotions and you are not able to basically go through their past traumas, which they have repressed so much that they are not able to bring it to their foresight, it can be used there. Combining it with cognitive behavioral approaches and potential for innovative treatments. Challenges, societal stigma, balancing ethical concerns with practical utility, and regulatory challenges. Alternate to narco-analysis is cognitive interview technique, role of AI in truth detection, and advanced psychological assessments. The open questions which can be here is how reliable is narco-analysis? Should it be used in evidence in courts? And what safeguards are necessary? I hope these questions are answered in this presentation. Now a small topic, abreaction. It's a therapeutic technique, involves reliving a repressed experience to release suppressed emotions. A type of catharsis that can help people confront and process traumatic events. You basically put a patient in a semi-trance state through hypnosis or any other technique and bring out the repressed emotions. The problem with this is that once you bring out the subconscious to conscious mind, the patient can even become aggressive and violent, the emotion that he has suppressed for so long. So the therapist should be very trained and skilled that how he's able to deal with those stuff and what should be the future course. The patient is encouraged to talk about the traumatic event. The patient relives the event under hypnosis or suggestions. The patient experiences the appropriate emotional response. The patient follows up with psychotherapy to process the material. Abreaction is used to treat trauma victims such as those with child abuse, post-traumatic stress disorder, or conversion symptoms. A domestic violence survivor who flinches and panics when someone raises their voice. A child who cries when their parent turns on an electric toothbrush after a painful experience at the dentist. So these are brief examples. One of the examples that I went through over the internet was that there was this very docile patient and he came to the psychotherapist, and while talking to the psychotherapist in hypnosis he started telling how he was traumatized while he was a child. He was good, well built, and then while he was a child he was abused, not abused but basically physically he was abused by his seniors while he was in school. And then after, as soon as he got out from the trance state, he became very, very violent and he started attacking everybody as he was able to see those images in those people. And then after future counseling, the symptoms got resolved. Acha, one of the points that you should remember is abreaction is not only limited to hypnosis. It can also happen to a normal patient when he's able to remember his past, and then he might behave violently. Summary is basically how, so basically narco-analysis or other techniques that a person goes through, narco-analysis, polygraph tests, and brain mapping. We are not able to discuss brain mapping briefly as it's a very long process and another topic on its own. Importance in psychiatry and forensics, how it can be used in the forensics and in psychiatric practices, like in psychiatric practices to bring out the repressed emotions, their past trauma, and in forensics, high profile cases, or if we are lacking evidences and we want to bring out the more information from the accused, and ethical and legal considerations, what is the validity in the court of law. These are my references. Thank you.